I think when it comes to like knee injuries lah, yang paling banyak experience ni Hazwan, treating and also being treated. So Hazwan, like how messed up is your knee? Can you just tell us? I don't know, man. I've known you for like 10 years. I don't know what's wrong with you.
Okay.
One knee or two knees?
It's
Yeah, one or
all.
two knee.
It's just one knee. I had 4 major surgeries on my left knee. First an ACL recon, and then 5 months after my first recon, it re-ruptured. So had to do a revision of the ACL recon. And then subsequently after that, I went and started playing. Got into a bad tackle, playing football. And then that one messed up lah sebab tu multi ligament. So my ACL, PCL, LCL and partial MCL. So nearly all the 4 cardinal knee ligaments tu memang torn lah. So basically 3 ligament tears in 3 years. So I was out for 4 years lah. So that's my experience. So the last one was of course meniscus koyak. So I think that's a sequelae of what could have happened. So luckily can repair. But then bila you want to speak about management, yeah, I think what I went through is what drove me to go into sports medicine. Okay, so I had my surgery and then masa tu as a medical student. So I think you guys pun know, being a medical student pun MC tu tak berapa jalan. You still have to go for classes. You still have to go for the walk rounds. So I was going for rounds in my brace and also on crutches lah. On day 13 post surgery sebab tak nak tangguh SEM punya pasal. Okay, so there I went through the physio and rehab process where I did my clinical semua, but I find it a bit odd sikit sebab I felt that it was too simplistic. And then just an examination was done and then just referred me to a physio, and in the end after 2-3 sessions I did my own research and did my own rehab. And then tu maybe yang led to that first the ACL failure tu lah after 5 months after my first surgery tu. Maybe I thought dah I'm ready to play. Oh, dah boleh lari full range of motion. Oh, it feels good, no more pain. And then just one movement, pop, dia just meletup balik. And then
the first one was the tackle, you
no,
injured your.
first and second one both are non-contact. So ikut the statistic lah. So 60% of my tests were non-contact injury. So memang ikut apa
I'm just
epidemiology.
curious lah. Like you were playing on grass ke, on artificial?
All on grass, but the surface was not that good lah. So the first one was in Singapore. The second one was actually dekat Pusat Sukan UiTM, and the third one masa tu just join for a tournament dekat Thailand. So
Okay. So it sounds like you progressed to a certain stage, but then you thought you were ready, and then I feel like there's a bit of lack of supervision lah kan. Maybe that's why. Or maybe no one stressed to you about the importance of like going stage by stage until you reach a certain stage that only you can start. So like,
yeah,
I
I agree. And then masa tu palatau, I guess.
5 bulan tak cukup
And
abang.
then feeling that overconfident. So I think this is what people going through yang went through an ACL recon and all have to understand and go through lah. But
Yeah.
then maybe masa tu pun it was the only option that was explained to me. It's like, oh, you have to go for surgery because you are active and in sports, and then you're going around places. If you want to play, you have to go for surgery. But then as going through my process and going through our specialist program and having further discussion, actually that's not the case.
Correct. It's not clear cut.
Yeah.
It's like you just because MRI tells you this and the finding is this doesn't mean poop, you got insurance and let's do a surgery. It's there's a lot more things that we need to talk about lah. Yeah, that's this new paper that came out. Was it just a few months ago, right? This KANON trial.
No,
What do
KANON
you think about it?
KANON trial has
Hazwan,
been around for ages. So one of the famous studies done by Dr. Phil Bay lah, from Melbourne Uni, if I'm not mistaken. Was it her or she was part of the study? But the KANON study is done in one of the Scandinavian countries where acute ACL, maksudnya ACL, they divided the patients into three. Within 2 weeks ACL recon. Second group is you go for rehab and physio dulu for, if I'm not mistaken, 3 to 4 months. So you go for surgery. And the third one was actually no surgeries at all.
Oh, okay.
Okay.
And what's the outcome
Alright.
like? Ada beza tak?
Okay. So this is the interesting part. So the outcome, we have to talk about the limitation of the study. The one that's not included in that study are professional athletes. Okay, but then what is included are high level athletes, and if I'm not mistaken in the study pun some playing at the national level. So you're not talking about professionals, so maybe amateurs, whom are 90% of kita punya population in our own clinic, playing sampai national level or international level, but not professional. So the outcome after 5 years, 2 years, 5 years and all, outcome no statistical significance.
So you're telling me that there's no difference when you do an operation, whether you do it early or delay or not do it?
Yep. So, but then the
Oh.
caveat is a high quality rehab.
Okay.
Okay. So,
Did
but
they
then,
define what's a high quality rehab?
I'm sorry.
Did they define what's a high quality rehab?
Yeah. So, yeah, I will go into that lah. So, they say basically a high quality rehab. So, I didn't really manage to pinpoint sebab they didn't differentiate between all the phases. But it is quite interesting because it really caught me off guard. And then when I first came up across the study in 2016, they started from 2010 until 2012 and they continue until 2015 the study.
Mm,
They tengok follow-ups. Of course, a lot of us kita risau bila ACL ni bila koyak abnormal movements. So leading to more cartilage injury, tulang rawan injured, and then of course I can say about secondary osteoarthritis and all. Okay, but then maybe that's when we think that we are not thinking about other stabilizers yang dynamic ke apa semua lah. So the outcome is actually again no statistical significance in terms of osteoarthritis at 2 years, 5 years, but then slightly more based on imaging and in terms of the scoring in those that went for early recon.
Oh,
So
the
early
ones that did
reconstruction.
early operation within like, I think they said,
Yeah,
is it 4
between 2 to
weeks?
4 weeks, I'm not
2 to
mistaken.
4. Oh, that's interesting.
So
I
there's
think
been hypothesis about this lah. Sebab and then you're saying that out of all the three groups, those that did not go for surgery to less osteoarthritis changes on imaging and also from biochemical. So basically for all those that's involved, I think about 120 plus patients, they aspirate, they took out the fluid from the knee and also sent for biochemical markers. Slightly lower, but no tak ada significance from statistics, is the non-surgical group.
Kiran, did you dissect this paper the same way, or do you have any conflicting views?
I think for this paper, the way I view it, they're not trying to advocate no surgery, right? Like what Hazwan said, the caveat there, the strong caveat there is the rehab component. So I think I think in my opinion, it's more of like you can try rehab first and then decide whether surgery is the best thing for you lah. But then okay, if you all don't mind, let's put the paper aside lah for one moment, right? So I think what we're highlighting here is two strong questions lah. Number one is perlu operate ke tak? Kan? Kalau dapat ACL ni perlu operate ke tak? And then the other question was tadi kalau nak operate, bagus operate awal ke rehab dulu betul-betul baru operate kan? Okay, so now I'm just asking you all clinically lah, like based on your clinical practice. Let's put this Canon trial aside for now.
Okay.
The first question tu apa tu? Kalau ada koyak
Operate ke tak
ACL,
operate?
operate ke tak operate? What do you all think? Like, I mean, how would you all go about that?
For me
Azlan,
lah, I look at two things lah. First, the symptom, what the person is complaining. Is it pain? Is it the knee doesn't feel stable? Or is it locking? So that depends on on the symptom. That's number one. Okay. Number two would be the goal. So goal would you can divide into two. One would be like what's his occupation? If this fella does like a high risk job, he's a firefighter, he's a policeman, maybe he might go towards and he has the symptoms, possibly he will need an operation lah. Or the person memang nak go back, wants to go back to sports that has a lot of pivoting movement and also is a collision or contact sport, most probably the person will need the operation. And
And
yeah, so
yeah,
there's
so
no
there's no
one
one
answer,
answer.
and it also depends on what the patient wants. Yeah.
from what you're saying is that symptom, that's number one, symptom. Do
Yep.
they, I think it's instability lah. If you say
That's what it is.
locking, meaning there's a concurrent injury already, right?
Yeah, that's meniscus
So
also. Yeah,
if we're just talking purely ACL, so got instability or not, right?
correct.
I think that's what you're alluding to. And then the
Right.
second one is the what do they want to do? What kind of
Correct.
background are they? Am I the guy who's want to be still active and doing all this high level stuff? Or am I the person who just want to do gardening or walk around for walks? No, I mean that's what we see like kan.
Right.
That's how we counsel
Yep.
counsel them like kan.
All right.
And then what about you, Hazwan? Macam do you have other
So this is one thing if we are talking about professional athletes, memang compulsory for ACL recon lah. I feel because you're talking from the economic standpoint of view, time wasted off the training ground. So you have to do that. And then they are already well prepped. Kalau professional athletes, their muscle already good, so they're good to go. Secondly, I always look at their orang punya socio-economic status. Okay. Or in terms of their mindset, some people already come to us already thinking about surgery. So their psychological state is surgery. So no matter how much rehab you do, they will feel this sensation of instability. Yeah.
Understand?
So sometimes you can have true instability, or you can have sebab dia dah mindset, oh you have to do surgery. So no matter how much rehab dia punya mindset, you have to go surgery, then I'll push, then yes, then maybe you have to go for surgery. But those yang undecided ni, this is where we have to discuss, because people always think ACL is a physical problem. From my experience, it's more a psychological issue because
can
it hurts. No, going through, it hurts more after the surgery. After
Oh, you're
each
talking
of
about
the,
your experience. Oh, sorry. I cannot fight that lah.
because I think this is where sometimes us as doctors, we put out our options, not going through what our patients going through. The first 5 days, every single surgery, I was like, why did I do the surgery?
Bro, why did you go for 4? I'm also curious, bro.
No,
How did you end
because
up
of
with
the
4?
pain, the swelling, the knee stiffness, and then masa my first surgery tu, it's like basically no proper immediate post-op rehab and all. So you can imagine after 4 weeks of brace tu, how stiff it was. And then and then after the second time, no, every single time, because you feel, okay, I've been through the surgery, I've done it. No, the second time, no, it didn't even prepare for me. The pain is like how swollen it is, how painful it is. And then going through after the second surgery recon tu, because I know I effed it up by going in too early. So trying to be patient. So do I have the patience to go through all this? So that's where it is. So sometimes I have to evaluate kalau my patients It's going to be a long-term punya process. You tak boleh take shortcuts. So are you willing to go through? Kalau you tak willing to go through, sometimes the complication of the surgery tu, the stiffness and then the chronic pain, tempat kita ambil graft and all, the muscle tightness sometimes can be much more worse than just the instability. So this is what we have to explain to the patients. Bukan scaremongering, but then if you don't go through it, it might just be far off worse than you not doing it.
Yeah, and again, like when you do the operation, you replace your ACL with your hamstring, which is a tendon, and you wait for it to incorporate, change back into somewhat like a ligament. Kan? It takes a bit of time, but yeah, the whole process of the operation with the surgeon will probably take you about 2-3 hours, but 1 whole year of dedicated, continuous, doing rehab, post-op. That's one thing that we have to preach to the patients. Yeah, that's interesting lah. That what has.
I think I want to circle back on what Azlan said about that 1 whole year thing. I think that's a good conversation to have, like in terms of return to play, right? But I think maybe we push that aside for now. So I think everyone gave their opinions on operate kena. So if it's high level athlete, I think no brainer lah. I think all of us agree, like what what Hazwan was explaining about the club and then the economic part of it. These people are paid to play, right? And they are missing time on the training field, missing time on the mat, on whatever. That is a no brainer lah. So, and then what about the soalan about aku dah dapat ACL tapi boleh kena tunggu benda tu swelling dah turun, dapat ROM balik dan baru nak buat ke ataupun buat terus, because macam if you see in America especially, all these professional athletes kan, pak ACL next day is already operated.
Yep.
But then I think in KKM or in all our practices, me personally, I advocate for getting the knee into the quiet knee lah, which is meaning no swelling, get the full range of motion back, and some activation of the muscle. So what do you all think on that?
Well, this is where the clinical acumen of everyone that's involved. Okay, so I have to take into consideration. If you go in with a very angry knee yang tengah swollen, range of motion tak full, so the risk of arthrofibrosis, the stiffening of the knee is very, very high and it's well documented. So this is where it has to be explained. But Zlatan did it after 48 hours. Yeah, Zlatan is Zlatan lah.
Okay.
No one can beat Zlatan.
But that's what's gonna come up, right? That's what they're gonna say.
But then are you as committed to go through your rehab like Zlatan? Are you gonna keep
Are you
your body
paid to do
weight
that?
just like
Yeah.
Zlatan?
No, I mean, but this is the common things lah, right? Especially they say, yeah, if Zlatan can do it straight away, why I need to wait?
I was fortunate to meet up with Zlatan's surgeon last December in Dubai. One of the surgeons that was here. So this question was also raised up. So he was saying, because he's a beast, so he took care of himself. His muscle was already very good even before surgery. And after surgery, he went through all the rehab process as a professional. So which hopefully in Malaysia, we will reach that one day. But then going through that, you can see when he came back from play, he still had complication. But people don't want to talk about that incident after coming back to return to play. So sometimes kita tengok bigger picture. But maybe Kiran, lagi satu Kiran